Happy Friday, everybody. It's a nice, beautiful fall morning, and today is September the 24th. I want to thank you guys for taking a look. Today, my guest is Dr. Kuldip Sandhu. He is our Medical Director for Utilization Management, and I know that is a big word, and what we thought we'd do today is actually just kind of educate you on what it is we have for utilization management within the group and what Dr. Sandhu's role is. So, Dr. Kuldip, thank you so much for being here. And I guess it'd be helpful to say, it'd be helpful for the people to know what is utilization management. So can you kind of define what that process is for us, or at least what it is?
So Peter, first thank you for giving me the opportunity to talk to our medical group.
Sure.
So utilization management, very briefly, is the process we use for our capitated patients or HMO patients.
Okay.
So they get the right care at the right place in a cost-effective manner.
Got it. Okay. So more of our managed care population.
Yes.
Okay. So what is the process we use for utilization management within the medical group here?
So we have a very structured program in UM.
Mm-hmm.
Daisy Planis, she's our manager for the UM services. And she has different nurses performing different roles. She has pre-authorization nurses, out-of-network nurses, inpatient nurses who manage our inpatients, Mercy Medical Group inpatients in the 4 service area hospitals. So they do the initial review and they use different criteria. For example, the intra-qual criteria, which the hospital systems also use. But our nurses, in addition, also use CMS criteria for our senior population and health plan guidelines. So they initially get the request, and if they approve based on those guidelines, then the patient gets a notification the service has been approved. If they are not sure about the approval, or if they think the approval should not be done, they cannot deny the service. Then it gets escalated to our physician leaders or associate UM medical directors, and then they can either approve the service and then patient gets similar notification, or they can deny the service. If that happens, then the patient has the right to appeal to their health plan.
Okay.
And then health plan can either agree with our associate medical director and keep the denial or overturn the denial. In that case, patient ends up getting the service done. If the health plan still denies the service, then the patient has the right to appeal to the Department of Managed Care.
Got it. Okay. Well, it sounds like a big role, and I kind of heard you say that there's a hospital arm, there's an ambulatory arm, there's a surgical arm. You know, it's a lot of work. There's a lot of players involved. I know that we have other physician leaders within the medical group who are part of this utilization process. So can you kind of let us know who those people are and kind of what part they do?
Yeah, thank you. So on the ambulatory side, we have 4 associate utilization medical directors: Dr. Ryan Nicholas, Dr. Kimberly Caffarella, and Dr. Arsh Nassim. And just this year, Dr. Evelyn Fanstein also joined us.
Okay.
And on the inpatient side, Dr. Jason Spear has the responsibility, and we are, as you know, we are putting some process in place how that would be done going forward.
Sure.
And on the surgical side, Dr. Eric Morse does all the reviews.
Got it. Okay. Good. So when do you step in your role as the medical director for utilization management?
So it depends. When the associate UM director wants to escalate the issue, then it comes to me. Sometimes they will defer the decision and would just want me to make the decision. If there's any appeals involved, then behind the scenes I get involved with our manager, Daisy Planis, or for example with Eric Morse, I got involved 2 times in the last week or so. Or if there's a complex patient in another hospital system like UCSF or Stanford, then Dr. Jason Spears and I get involved. And so on those instances, they will pull me in, and then I get involved.
Gotcha.
And then obviously significant time I spent attending all the meetings with health plans and so many other meetings, as you can imagine,
Yeah.
which I don't think I would go over, but there are
Well, we all love meetings, don't we?
Lot of meetings.
Gotcha. So since you've stepped in your role, is there any new policies or processes that you've put in place to make things a little bit better or smoother?
So one of the changes, happened recently in the last month or so, with Dr. Valenzuela, you were involved in addition to Dr. Chatzel and Dr. Eric Morse.
Mm-hmm.
And that's dealing with the second opinion for our WHA or WA patients.
Yeah.
Because one of the challenge for all these health plans is that once the patient gets the authorization for second opinion from a tertiary care center, then they request other services, and the patient has a hard time accepting that we can provide similar service in our group.
Sure.
So to address that issue for all, at least surgical care services for the time being, Dr. Eric Morse behind the scenes looked at those second opinions and gave feedback to the health plan. Second opinion denial or authorization is the purview of the health plan. It's carved out to them. It's not for medical group. So it's ultimately their decision. We are just providing an advisory role. And on the medical side, I think they will get me involved if that issue comes.
Got it. Okay.
So second thing I think we did, our utilization management nurses, as you know, the health plan, the Department of Managed Care has guidelines how soon a primary care patient needs to be seen on urgent basis versus routine basis. And there are also different guidelines for specialists for those two metrics. So our utilization management nurses would call, for example, GI office and say, this patient needs to be seen in the next 2 weeks. Can you see them? And if the front office says, no, we don't have any opening, they will approve out of group referral.
Mm-hmm.
So the change we made now, they won't be calling the front office. They will send an email to all division chairs, respective division chairs, and the division chair says, yes, we can provide service inside our group within a timely fashion. Then the patient would not be referred to out of group.
Sure.
So that's another change we made recently.
Well, good. And it sounds like that's making our processes better.
I think so.
Good.
Yeah.
Well, Dr. Sandhu, I want to thank you for taking time to make this video today to help educate our group on utilization management and your role. And obviously, as we move more towards value-based care, we're taking more and more risk-based contract like managed care, capitated lives. Right now, within our group, almost a third of what we do and the patients we care for are in some form of a risk agreement. So this is why utilization management is so important. And this is why having you learn a little bit about this is helpful for us so that you can partner with us moving forward. And you can understand who our leaders are in this process and also work with them to make sure that we take care of the patient the best that we can. So with that, I will say thank you to Dr. Sandhu for being here with us today, and I hope you guys have a great weekend. So take care and goodbye.
And Peter, thank you so much for this opportunity so our medical group physicians and APPs can learn the process. And if they have any questions, they can contact me anytime.
Hey, sounds great. Thanks so much.
Thank you.
Goodbye.